Those who've experienced reflexology, either through giving or receiving a treatment, will agree that it's a powerful complementary therapy and a wonderful way of reaching optimum health. The reflex points of the feet and hands to which pressure is applied mirror the whole of your body. The success of this natural therapy relies on the interpretive, intuitional and interactive skills of the reflexologist. These qualities are most effective when combined with a thorough understanding of the treatment program. This video gives you a hands-on opportunity to learn a professional reflexology treatment. The treatment's been used successfully by hundreds of practitioners I've trained over the years. Once you've mastered this program, you can then apply yourself completely to giving a holistic treatment, which will be of great benefit to many. To obtain the best from this video, get your hands on a pair of feet and work along with me until you can remember the entire program. So let's work together to learn this exciting and rewarding therapy. Okay, so the first thing we're going to do is wipe the feet over, and we're going to use a wet wipe, and we can use either a drop of lavender or tea tree to refresh the feet, and we're going to just wipe over the feet nicely just to clean them and get the person relaxed and have their foot nice and clean for us. So we're just going to thoroughly wipe over that foot, and then we'll just use another one for the other foot. Remember as well just to place your hands on the feet, on the lower legs, feel them. What does the circulation feel like? Are they hot? Are they cold? Are they clammy? Just to give you an idea to the person's circulation. Also, if there's any broken veins or capillaries around here, just work lightly over those. If there's any varicose veins, just avoid working on them and work around that area. Any verrucas or warts, just cover them with a plaster. Any athlete's foot, just avoid that area. The first thing we're going to do now is just apply some talcum powder to the feet, and we don't need an awful lot of talc, just enough to stop us sliding over the foot so we can get the right pressure when we're working on the reflex points. We're just going to massage the talc into the foot, and this gets the client feeling nice and comfortable, and they get used to having their foot worked. And then the same on the other foot. And then we're going to start the treatment. And the first thing that we're going to do is the opening movements, is to nicely relax the person. And then we are going to start with our rotating the foot one way and then the other way, gripping with the right one just under the metatarsal arch, and then stretch the Achilles, stretch, release, and the stretch comes from the lower hand, the top hand, here the right hand just supports. Thumbs behind to support, and stretch open the chest on the top with the pads of the fingers. Come down between 1 and 2 and press in here and rotate in for the solar plexus point and hook right into this and work into it. Remember, this is very good to relax them, helps with all sorts of stress and tension, and then we're going to repeat those movements on this foot. So the first thing that we're going to do is rotate the foot one way, then the other way. If you want to do it this way round, that's fine as well. Stretch the Achilles, open the chest, open this chest area, give it a good stretch. Come down with the left thumb, down between 1 and 2, under the ball of the foot, and press in and work into the solar plexus. Sometimes this can be a little bit sensitive, so don't lose your contact with the client. We want to make sure that we're doing well here with the treatment. We need to get some feedback and make sure that they're comfortable. How does that feel, Nicola? Good. And now we're going to start the treatment. The first area to be treated is the 7 cervical vertebrae. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 1, 2, 3 rows. Then we carry on going up and over for the head and neck. And we do this twice. Remember to work right down the side, right down to the base, to the root of that toe. And then with the side of the thumb here, we're going to go across for the brain reflexes. And we have 3 rows here. And then we're going to do the front of the neck. That's like a bird's beak, and we start here, and the thumb supports behind, and we use the index and second finger to come round like so, supporting the top of the toe with the left, and coming all the way round until we finish under the nail. And then we're going to go behind to the back, to the base of the toe, 3 rows. 1, the right thumb, drop in with each row, 2 and 3. Come back a few steps, go up and hook in for the occipital point. 3 more steps for the ear, and across here for the pineal and hypothalamus. Pituitary, hook in and stimulate for the pituitary. We're rotating, divide the toe into 4, it's slightly off centre, should feel like you're moving a pea or pinhead around to the client, otherwise use a knuckle and work in with that. Now we're on to the sinuses. We're going to go up one side with one thumb, up the other side, and straight up the middle, and drain. And we're going to do this on each one. And when we get to the small toe, it can become a little bit more awkward, so we need to use our intuition and see how comfortable it is. Otherwise, come back up like this, up the other side, and drain. Hold down like this. This opens this paddy area here, and we're going to go across one way and then come back the other way, reversing the hand position for the general eye and ear reflexes. And then we're going to hold down, put the thumb between the second and third toe, not right between it, come back a little bit and press in to hook in here for the eye reflex point. And then between 4 and 5, angling more into 4 for the ear. And then on the top, between 3 and 4, we're going to work down about ½ an inch for the eustachian tube. That's the tube between the nose and the ear. And we're just going to help ease any congestion here. When we work up to the top with the thumb, we're working with the thumb behind and the index on the top, and we're just rotating and squeezing into here just to stimulate that point thoroughly. And then we're going across to between 4 and 5, and we're coming down on the side of 4 about ½ an inch for the balanced inner ear point, and coming back up and just hooking in on the side of here to pick this up. Good. And then between 4 and 5 for the shoulder, we're going down about 1.5 inches, 2 inches, and working back up again. We're doing the thumb behind and the index on the top, so we're working with the thumb and the index finger. And then we're going to, if you've got a small hand and a huge foot, you can always use the thumb to go down on the top, like so, and come back up. And then fill in underneath to cover this whole area for the shoulder, for the scapula, shoulder blade, and hooking and rotating into any sensitive points. Diaphragm, come across one way, and then we go back the other way. If this is very tight, a good way to do this is to just flex this down as you're coming across. Really flex it down, and that can really open the area for you.